My critical care instructor is involved now in our cardiac cath lab. This is new to us in the last 9 months. And she's an extremely bright woman and came down one day just so excited about having gone through an interactive program and felt that within a 3-hour period that she had learned more than her researching of the literature and field trips and all had accomplished in 3 or 4 months. She was just terribly excited.
The fact of interactive video disc and technology is that it allows that type of progression. I mean, it's constant. Nurses constantly are going to continuing education programs. What would be better than having some of this when you talk about cost effectiveness and having interactive video discs where people in their own setting can keep abreast of the changes that's happening in nursing? It's absolutely a phenomenal kind of thing. Also, it allows in some of your technical kinds of nursing fields like critical care nursing, emergency rooms, they oftentimes are really pressed and pushed for time. This would be an excellent avenue for those type of nurses to keep abreast of some of the fast-paced kinds of changes in those critical care areas.
I think that it's starting to really get a foothold in medical education right now. It just came from the Nebraska Symposium on video discs, and there were quite a few applications in medicine. In fact, this year's top video disc was awarded to Dr. Joe Henderson at the Uniformed Services Medical School across the street for a video disc on combat trauma. So it's quite a bit that's going on now in medical education.
There are some hospitals who have been using interactive video, and they have found it extremely cost-effective simply because they don't lose money from nurses taking time off the job.
The evidence is that it's a very effective training tool. It cuts the training time down. It releases trainers to do more work. It allows people to progress at their own pace and at their own times. You can train 24 hours a day.
I'm very excited about it, frankly. I think interactive video and video disc technology is the wave of the future. Not even the future, it's here, and it's here to stay. Those of us in healthcare are faced with tremendous problems on increasing productivity and increasing the productivity of the education and training function as well.
It's a 12-inch disc with 20,000 pictures. And the kind of the fun thing about this is that it kind of evolved, and there's some disadvantages to that, but I didn't know what I was getting into when I started this, and it's probably just as well. I didn't know anything about computers, and I still don't know much. And my impetus really came from medical students.
I'm a radiologist. I have a bank of 5,000 or so cases that have good radiologic pathologic correlation. And the problem I was faced with was that there were not enough, people did not use it because it was difficult to pull all the slides out. You had to pull them out. You had to, first of all, go to your computer to find out if you had an example of what they wanted. Then you had to go and find out if the case was present. You had to clean the slides. You had to sign them out to somebody. And then you might not ever get them back because it was so hard to keep track of everything. So I basically stumbled across the Panasonic, which is, as I mentioned, a recordable medium, and it really met what we needed.
I mean, how much benefit is it going to get in terms of, do you want qualified nurses? Do you want nurses working in your setting? What's going to bring them here? They want sophisticated learning approaches. They want to be able to say that the hospital is progressive, they're meeting our needs, especially when you look at patient education, especially the way healthcare is going. When you talk about ambulatory care nursing, which I was an education specialist for about a year in that, the patients that come through that system is incredible. And nurses have got to be able to do training fast, on the spot. We're talking about elaborate surgical procedures being done on an outpatient basis, and you may be with that patient maybe a half hour.
You can't kill the video disc. And if you make an incision at the wrong place, you can go back and rectify it. But in fact, some of the newer simulations are extremely effective because there are available commercial programs on critical care in the emergency room, for instance, where a young resident may never have seen anything like what he's exposed to on the video disc, and gets an opportunity to then to make decisions, and if they're wrong, he is informed of this, but he hasn't lost a patient, so he gets a chance to go back and do it again.